And then when we do believe that a person is at risk of completing a suicide, in the beginning of treatment, one of the first things we do is work with them to complete a suicide narrative. That is, we want to take into consideration the background things that kind of set them up and put them in a distressful situation, so that the things that happened in the immediate past that led them to very strong ideation and or taking the step to attempt suicide are the things that we understand, both in terms of their thoughts, their emotions, their behaviors, what other people did. So we want to know all of those things so that we can take those into consideration as part of the relevant background information. In the beginning of treatment, we also develop, we do safety planning. Safety planning, a brief collaborative intervention to minimize acute risk. And I'll talk about that in just a minute. And then the third thing that we do in the early phase of treatment is develop our cognitive conceptualization. The contents of safety planning basically address helping the person come to terms with what are the warning signs when you're feeling empty, when you're feeling lost, when you're alone, when you're reminded of certain kinds of things. What are the things that for you as an individual make you start to have suicide ideation and think about acting on those? But for safety planning, in the first level, we talk about what are the things that you can do all by yourself to serve as a distraction to take your mind off of what you're thinking about. It can involve reading, watching sports on television, going for a walk, going to the gym, all kinds of things that we have control over that don't involve coordinating or scheduling with other people. The next level would be to coordinate with other people, to set up things that we can do, activities that we enjoy participating in, that they enjoy participating in, that just serve as a distraction, take our mind away from it. These other people may not have any idea what we're going through or what we're thinking about, and or the value that it is serving by participating in those things. And then the next level are the people that we can ask for help during a crisis intervention. This is usually a very few, limited number of people who know and understand what we're going through and can help us at a time of great distress. The next level is to identify professionals and agencies, including all of their contact information that they can contact. And that can include their primary care doctor, emergency rooms, and their therapist. We have to be careful about giving the impression that as their therapist, that we're on call 24 hours a day, 7 days a week, though. We want to make sure that they realize that we're very willing to help, but there may be times when we're not available and that they will need to rely on other people. And that's why it's important to have a list of other people as well. And then it's important that we make the environment safe, that we remove. So if somebody is prone toward overdosing their medications, either get a medication change or have somebody else hold on to their medication so that even if they are tempted, they don't literally have the ability to do it. Or if they're thinking about suicide by gunshot, that we remove the guns from the home so that they cannot act on impulse.